had an inkling really from the previous pandemics of SARS and MERS that the nervous system was involved in coronavirus. So that we were expecting there to be some complications neurologically. And it was first published in about February from China that a study looked at neurological complications in COVID-19 patients. And about 36% of their patients had neurological complications. That included headache, confusion, muscle pains, but it wasn't clear from that study whether this was due to patients being very sick with low levels of oxygen or sepsis or the medications, or was this actually related to the virus itself causing neurological problems, or a consequence of the immune system triggering off the complications. And so we set up at the National Hospital Queen Square a virtual encephalitis meeting every week, and we published our findings in the journal Brain last year. And what we were able to describe was a spectrum of disorders that one was seeing in acute COVID. Now, these were inpatients in hospital, a highly selected group of patients. And what we found was there was a group of patients who had what's called encephalopathy, i.e., they were disorientated, they were confused. And this was usually in more elderly patients. But in them, the investigations such as MRI scan or lumbar puncture tests were all normal or negative. And this group generally did pretty well in terms of recovery with time. The second group was one that we labeled as inflammation. So these are patients who had what's called encephalitis or acute disseminated encephalomyelitis, which is an inflammatory condition of the brain. And these patients were pretty ill in terms of their neurological damage. They had abnormal scans or abnormal lumbar puncture tests, and they required treatment either with steroid medications or intravenous immunoglobulin. So this was the inflammatory group. And then the other one, which people are well aware of, is the high incidence of strokes. And patients in this group had what are called large vessel strokes in multiple territories, but they also had evidence of thrombosis outside the brain and nervous system. So they had clots in the leg, clots in the lungs, clots in the kidneys. And so the impression was that one of the underlying pathophysiological mechanisms here is that you have inflammation in the blood vessels and endotheliitis, which has been shown in postmortem studies. But also there was this driving of the thrombotic tendencies. So it's a combination of the two, which was leading to these relatively unusual presentations of large vessel strokes in relatively young people, some without any risk factors. So those are the big groups of patients that we were seeing in the acute stages. And so what's become apparent subsequently is that as the numbers have gone up, as the papers have been published, there are a number of other neurological complications, including movement disorders.